At least 1.48 million Kenyans are currently living with HIV. This is according to the latest data released by the National Syndemic Diseases Control Council. Women and girls are bearing a disproportionate burden for the epidemic as compared to men. Despite this, Kenya has made notable progress in the fight against HIV, recording declines in mother-to-child transmission and maintaining gains in treatment coverage. However, new infections, particularly among adolescents and young people, continue to pose a major challenge.
Despite decades of progress in HIV prevention and treatment, Kenya continues to face a significant HIV burden, with an estimated 1.48 million people currently living with the virus. According to the National Syndemic Disease Control Council, the national prevalence now stands at 3.22%. The epidemic continues to affect women more than men, with a higher prevalence among females at 4.3% as compared to males at 2.1%. Children remain among the most vulnerable groups, with 69,330 children aged between 0 and 14 years currently living with HIV. In 2026, Kenya recorded 13,936 new HIV infections. Adolescents and young people continue to account for a significant share of new infections at 41%. Adult new infections stood at 10,539, while the new infections among adolescents and young people aged between 15 to 24 years were 4,321.
Out of all the new HIV infections, 62% occurred among young people and young adults aged between 15 and 39.
Health experts are particularly concerned about the high rate of infections among young people, underscoring the need for targeted awareness campaigns, testing services, and access to prevention tools. Meanwhile, Kenya has recorded progress in efforts to eliminate mother-to-child transmission of HIV. The rate of mother-to-child transmission now stands at 8.04%, a drop from the recorded 9.3% in 2024.
Kenya still records approximately 14,000 new HIV infections annually, including more than 3,000 among children. At the same time, people living with HIV are living longer and increasingly require more integrated services that address non-communicable diseases, mental health condition, reproductive health needs, and other chronic illness. Ladies and gentlemen, the changing health landscape, coupled with the evolving global financing realities, require us to rethink how we organize, finance, deliver health services.
Health officials note that treatment interruptions among mothers continue to contribute to new infections among children. According to the National Syndemic Disease Control Council, 38% of HIV infections among children were linked to mothers dropping off the antiretroviral treatment during breastfeeding. The impact of the epidemic remains devastating, with more than 19,000 AIDS-related deaths recorded in 2026. The burden of HIV is also unevenly distributed across the country, with 10 counties accounting for the majority of cases. The high-burden counties include Nairobi, Homa Bay, Kisumu, Siaya, Migori, Busia, Kakamega, Mombasa, Kiambu, and Nakuru. As Kenya works towards ending HIV as a public health threat, experts say greater focus must now be placed on adolescents, young women and mothers, while ensuring uninterrupted access to treatment and prevention services across the country. Helen Aura, NTV.